Well, Victorian Premier Daniel Andrews says he's going to be keeping a close eye across the ACT and New South Wales roadmaps to freedom. And Premier Andrews joins us now from Melbourne. Good morning, Premier. Welcome to News Breakfast.
Very good to be with you, Lisa.
The New South Wales Premier yesterday said she was hoping that you were going to be on a unity ticket, as it were, the same position on the roadmap out to freedom. Are you?
Well, we're certainly on a unity ticket to deliver the national plan and to end lockdowns and to get our states open. I'm sure that when you speak with her a bit later in the morning, that's what's dominating her, and that's what I'm working every day to try and achieve. And today we passed an important milestone, 80% single dose. There's some freedoms that come with that for some outdoor activities, golf and tennis and boating and things like that. Our 10-kilometre limit for movement for those 4 hours a day when you can be out of your house goes to 15 kilometres. We're not overselling that. It's a modest set of changes, but that really is the key, Lisa. You've got to do what's safe and you've got to calibrate it against a growing but a not yet complete community vaccination rate.
Why can't Victoria have the same freedoms as New South Wales is being promised at 70% and 80%?
Well, we followed off very detailed health advice. We're going to end our lockdown when we get to 70% double dose. States are different, different governments, different chief health officers perhaps provide different advice. But look, ultimately we're all working toward the same goal, and that is to manage the number of people who will finish up in our hospital system, to care for them appropriately, but to not have our nurses given an unfair fight, not to have our nurses essentially overwhelmed. This is a pandemic of the unvaccinated. That group is too big at the moment. As we get to 70 and 80% double dose, then the group of unvaccinated in our community shrinks, and then we can manage that, because once we open, of course, the virus will spread. So different leaders will look at things differently, but we do get the advantage because extra vaccines went to New South Wales. We'll get to look and see what happens in New South Wales once they hit the 70% mark. We may well be able to learn from that, just as they, I'm sure, learnt from our second wave last year.
Yeah, well, it looks like you're going to have enough Pfizer and Moderna in Victoria to vaccinate everyone over the age of 12. So does that mean you can bring back the interval between the doses from 6 weeks to 3 weeks and set Victoria free earlier?
Well, we're certainly looking at that. We've got a little bit of a wrinkle in the last week in October. We've just got to wait for some final... we have to have it confirmed that we're getting the sort of stocks that we think we're going to get, and then that's something that our medical experts are looking at. And if we can reduce that dose interval, Lisa, as you say, then that'll mean we get more people through the gateway, that second dose gateway, and that may give us more options, and it may see us bring forward some of the timelines. The important point for your viewers today, you've got Moderna and AstraZeneca at community pharmacies, hundreds of them across the state. Please book an appointment and go. GPs doing an amazing job. They've got Pfizer and Astra, and our state hubs, some 55 of them plus pop-ups right across the state. We've done 3.5 million jabs in our state hubs alone. So there is supply, there are appointments, and freedom is absolutely pegged against getting those vaccination rates up. So please book an appointment and turn up.
Well, the vast majority of Victorians have done everything you've asked of them, and they are absolutely weary. You have said that yourselves. I was talking to my taxi driver this morning. He said he doesn't need to go overseas. He just needs to know, when's he going to be able to stand up in a pub and have a beer? And you haven't told people that yet.
Well, no, we have. We absolutely have. We've indicated that when we get to 80% double dose, which will be just a couple of weeks after we reach 70% double dose, then we'll have people inside at the pub, we'll have people outside at the pub. We will be open.
Standing.
Nothing
They're going
will
to be
closed
sitting,
pretty
though.
much.
They're going to be sitting, aren't they, inside the pub?
Well, sorry. Yes, you are. You are technically right. We'll get people standing and being able to have a drink without a meal as soon as we possibly can. This is staggered, it's staged, and it has to be. Because even once you get to 80%, that's still 20% of the community that are not vaccinated. And if the virus races through them, as it will, then we're going to finish up with a lot of people in hospital. But look, today's a very significant day. This roadmap is about hope and being positive. Victorians and Australians are coming forward and getting vaccinated, and that means that lockdowns will end. We will be free, we will be open, we will normalise this. It's not about endless suppression. It is about getting past this. And it'll be a very challenging time for our nurses particularly. But we'll be with them, we'll stand with them. And the most important point is, if you don't want to finish up in hospital and you don't want to finish up really, really sick with this, then get vaccinated and make an appointment today. They're available. It's the best thing you can do for yourself, for the people you love, and to get us all free.
So, Premier, let's look at this for an example, because the theatres are opening in Sydney on October the 19th, one of the first performances. If we're only a few weeks behind New South Wales, why aren't you sort of setting dates for big crowds at live events now?
Well, we have actually set dates for up to 5,000 at a whole range of different outdoor events. Indoors a little more challenging, but look, let's be very clear about this. The roadmap that we've produced to deliver the national plan is not in 7 or 8 volumes. It is a framework document, and each day since we announced it about a week ago, we have made further announcements to fill in detail. Because each day that passes, you have greater certainty about what the weeks and the months ahead look like. Modelling is based on assumptions. Each day we get a real case number, actuals, and that gives you greater confidence and greater certainty to plan for the future. So we've made announcements about the vaccinated economy, announcements about the return to school, all sorts of different announcements every day in the last week or two, and we'll continue to do that, Lisa. So by the time we get to 70% double dosed, which is a few weeks away, then the lockdown will end, and then we'll start providing even further detail about what 80% double dose looks like. New South Wales are, in fact, they're out in front of us because they were given additional vaccine supply. We don't begrudge them that. It means that we'll be able to watch on and see exactly how this unfolds, particularly from a health system point of view. But we have been providing further detail, and we will continue to do that.
Melbourne City's really hurting. When do you want to get people back into the offices? When are you going to tell them to head back in?
Well, the roadmap speaks about the return to offices, and we'll have more to say about that. There will be some rules around masks, and there will be things like that. But look, the most important thing is that we just work through each of these stages in a sequential, logical way. As people get vaccinated, we have more freedom, we open up, and we get back to normal. We can't necessarily answer every single question right now because these targets are some weeks off. And again, as I said before, trying to predict this, trying to be absolutely down to the hour is very hard because there are a lot of uncertainties. We just have to keep getting people vaccinated, and that gives us many, many more options, and we can get past this and get back to something that is very much like normal. We can see past it now. We just got to get people to work with us and finish it off by getting vaccinated. But you're right what you said before. Victorians have done an amazing job. I'm very proud of them. The absolute resilience of the Victorian community is something to behold.
Premier, I just want to circle back to this idea of the comparisons with New South Wales, because we're certainly getting a lot of people saying, you know, you've already said, yes, different governments, different approaches, but people in Victoria are going to be looking at what's happening in New South Wales. They're going to be looking at them heading back to the hair salons and to the theatre and to the restaurants. And these two states, which are so very similar, you are taking a much more cautious approach, aren't you? And why are you doing that?
Lisa, we're taking an approach that's based on public health advice. And that's what's got us to this point, that's what's got us through, and that's what we'll continue to see. Yes, more people in hospital, but less than would otherwise be the case. It's a very precious thing, our health system, and we have to be careful to manage those additional patients. I'm not going to give to our nurses a fight they cannot win. It's going to be very tough for them in the weeks and months ahead, but we have to protect our ICU capacity, our hospital capacity, and it's not about beds and ventilators. We have enough of those. What we don't have is a workforce that hasn't got fatigue, that isn't bearing, you know, having to deal with the cost of the last 20 months. It's been a very difficult time. So look, I'm not here to apologise for doing this cautiously and following the science. I'm here to encourage people to get vaccinated, and I'm here to celebrate a really important milestone. We will today pass 80% single dose. That is an amazing achievement, and all Victorians that have been vaccinated or have booked an appointment should be very, very proud of that. I'll leave the comparisons with other states to others. We're going to get this done, and we're going to get it done properly. And I'm very positive and optimistic about the future because we can see past this now.
Dan Andrews, thanks for joining us this morning.
Pleasure. Thanks for having us on.